Yes,
Rapid
Spokane.
City,
Woo.
the Dalles, Oregon, Duvall, Washington, Kaiser, Oregon.
I'm wondering if we'll get any Hawaiis or anything fun like that. We'll see. So if you guys are just joining in, everyone is putting their first and last name and where they're from in the chat real quick.
Yeah, Cut Bank, Montana, nice. Bozeman, Montana. You guys are from all over the place. This is good. Happy Valley, Oregon. Sounds like a pleasant place.
Okay, so Jamie, I don't know if, do you want to start the intro? Because I'm going to keep admitting people as they come in through the waiting room.
Definitely, yeah. Okay, so we are just going to do a quick introduction with our panelists that we have today. So give me just 1 second. All right, so we're going to start with our faculty. So, or I guess we should start with ourselves. Maybe that would be helpful. Yeah. So as your moderators tonight, we have myself. My name is Jamie Severson. I am an admission counselor at Carroll College. And then we have Hannah. I'll let you introduce yourself real quick.
Yeah, welcome everyone. My name's Hannah Sylvester. I'm also an admission counselor at Carroll. Sorry, I'm just also multitasking. Okay, I work with students in Eastern Washington and North Idaho and the Missoula and Bitterroot regions, but we're just going to be your moderators today. So thank you for joining.
Awesome. So we have such a good mix of people for our prospective students today. So wherever you're tuning in from, we're really excited for this panel. So we have a professor at Carroll College for you. We have some Carroll alumni, and then we have a couple students that are currently in the nursing program. So I want to start with introductions with Leah Chavarez. If you want to go ahead and introduce yourself and your title, and maybe where you're from and how you're connected to Carroll, because you got a good story there.
Yeah, you bet. Hi, everybody. Thank you so much for joining in. My name is Leah Chavarez. I'm from the Pacific Northwest, so Western Oregon, Spokane, Washington, then high school in Southern Idaho, west of Boise, almost back in Oregon again. And I am one of the lab facilitators up here. I'm actually a Carroll alumni. I graduated in 2005. I started my nursing career out in Minnesota at the Mayo Clinic, and then I got my master's degree at the University of Minnesota, Twin Cities. So if you're familiar with that, go Golden Gophers. Yes, 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 Chip. So yeah, I'm a gerontological nurse practitioner. I married a Montana boy. So when we had children, he said that we needed to raise them in Montana. So we found our way back here in 2014. And then I found my way into academia. And that's kind of the little bit, but I have more to say later. But that's kind of how I got back to Carroll.
Awesome. Thank you, Leah. So next up, I'm going to introduce our alumni or have them introduce themselves. We'll start with Allie Roberts, and then we'll go to Delaney Cummings. Allie, if you want to go ahead and introduce yourself.
Hi, everybody. I'm Allie. I am from the class of 2018. So I've been a nurse for about 3 years now. Still doing bedside nursing, and I'm currently working labor and delivery. I started out and did a year of oncology nursing in Spokane, but then missed Helena, as you guys will all soon find out once you attend. You will miss Helena and you'll want to come back. So came back. I'm doing labor and delivery now, and I love it. And I cheered during my time at Carroll on the cheer team, as well as had some involvement with campus ministry, which is amazing as well. And now I'm coaching the Carroll cheer team, so still involved in Carroll. Love Carroll. And yeah, that's kind of where I'm at.
Awesome. Thank you, Allie. And then Delaney, we'll go over to you.
I am Delaney. I graduated in 2018 with Allie. Actually, we were in the same class. My first job was in Boise, Idaho. I went down there and I worked in telemetry for about 2.5 years. Loved that, super fun job. And then I moved here. I got engaged and my fiance lives here in Spokane. So I moved here to Spokane back in October, and I'm working in advanced care at Holy Family Hospital, which is just like an ICU step down unit. So another really, really fun really good job to have. And I can't say enough about Carroll. I absolutely loved my experience there. I think it set me up as good as you could possibly get set up to be in the real nursing world. And I actually, like Allie, I was involved in sports myself too. I did track and field while I was at Carroll and had just an awesome time doing that. So I don't know if any of you are thinking about doing sports, but it's definitely possible to do with nursing, and definitely a really good opportunity if anyone's interested in that too. So
Awesome. Thanks, Delaney. Delaney, you're always my example when students are like, can I do sports and nursing? I'm like, yes, you can.
yes, you can.
Okay, you can. So now we have a couple current students with us. So I'm going to start with Elaine Boos, and then we'll move to Allie Buckner after that. So Elaine, do you want to just introduce where you're from, what you're studying, and all that jazz?
Cool, yeah, so I'm from Ennis, Montana originally. I'm a junior in the nursing program here at Carroll. Some other things that I'm involved with, I also am a peer minister on the floor here at Carroll. And then I'm the treasurer for Engineers Without Borders, which I can talk more about if you guys want. And then also I'm part of like the Carroll College Student Nurses Association. So this kind of other organization that I can also talk about a little bit later. But yeah, those are kind of the big things.
Awesome. Thank you, Elaine. Allie Buckner, will you introduce yourself?
Yes, absolutely. Hi guys, so my name's Allie and I'm a senior here at Carroll. I'm obviously in the nursing program. I'm from Bozeman, Montana, so not too far. And yeah, besides nursing, I'm pretty involved on campus. I am really involved in the outdoor program, the Carroll Adventure Mountaineering program, which is a blast. And besides that, I also kind of like Elaine, I'm also involved with Engineers Without Borders. I'm the secretary for the club and part of the Uganda project, which is pretty exciting. And then along with that, kind of random involvement with campus ministry and service Saturdays that we have, volunteer opportunities on campus. I work on campus and just found doing kind of whatever random shenanigans you can find that Carroll's putting on. I'll probably be there.
Awesome. Thank you so much, you guys. And then just one more person, our president of enrollment, Chip Hinton, is here. Chip, will you just introduce yourself real quick?
Sure. I think you did an excellent job, by the way. So I would just say welcome to everybody, and I'm looking forward to learning more about you. Thank you so much for joining us tonight.
Awesome. Thanks.
All right. Okay. So what we're going to kind of do first is I'm just going to ask a couple scattered questions to our speakers, and then we're going to completely open it up for your guys' questions. Leah is in the lab space right now, so I think she can show you guys a little bit about that. And also, if any of you are struggling with being on like grid view, so our cameras or our boxes are really small, if you turn on speaker view, you'll be able to see like Leah's lab spaces a little better as well. So I think to start, Leah, we just want to ask you a couple quick questions, and we can show the lab space now or in a little bit. It's totally up to you. But what do you think makes the nursing program at Carroll College particularly distinctive or attractive for our prospective students? Like, what are some of the differing features? What are the benefits of our program? And just talk a little bit about what makes our program a little different.
That is a great question, Hannah, because there's so many outstanding programs out there, right? We are so lucky in the nursing profession to have just wonderful opportunities. So something that stands out to me as someone who's kind of worked around the country a little bit, we get our students into clinicals, acute care and nursing home sophomore year, fall semester, sophomore year. First, that freshman year, you're doing, so if you love science like me, I minored in biology when I was here because I love all that. You get amazing anatomy and physiology, chemistry, psychology that first year, and along with some cores. But again, once we get you into our nursing classes, which is that second year, that first semester, you're out in clinicals, and then you're in clinicals every semester after that. A lot of programs out there, you're only in clinicals the last 2 years, but with us, you're in there all 3 years. We have a really great mentor program, right? So we have the seniors that connect with the sophomores and the juniors connect with the sophomores. It's and I think Lane can probably talk, and Allie can probably talk about that as well. With our Student Nurses Association, very active. They do a ton of really good work in the community. So not only are you active on campus, but you also get to reach out. We have a homeless shelter called God's Love here. We have an inpatient pediatric psychiatric hospital called Shodair. And so we do hygiene drives and Christmas drives and all sorts of really fun things. Our labs are small. So I'm a lab facilitator. We've got another lab facilitator and our faculty. So the Board of Nursing for Montana says that really like you should have faculty a 1-to-10 ratio, okay? Our maximum number of students in our labs are 12 students. And then there's going to be 2 of us, so 2 faculty, which makes that ratio 1-to-6, right? So you get a lot of like one-on-one or very small group. And again, you know, the students can speak to that as well. Both have probably spent more time than they thought they ever would with me. So that's something that is a lot of fun. I will show you a little bit more about the lab, but we got a grant about, gosh, it's been, we've been in the space for about a year from E.L. Wiegand. So we were able to renovate our whole 4th floor. We got 7 new high fidelity simulators and a lot of technology as far as, so we can videotape what we're doing with the simulations and the skills. And like I said, I'll show you that. But my favorite part is that all of the cool technology that we have is all to augment that person-to-person experience, okay? It does not take the place of getting you out into real clinical settings. It's just to give you really great practice opportunities. And then our faculty, it's like a family. We love being here. We love working here. Our Carroll community is just outstanding. I can't say enough about, it's the best. And I've worked on some really great teams. It's the best team I've ever been on.
Thank you so much, Leah. I really appreciate that. Allie and Delaney, I'm gonna ask you guys a quick question. Oh, hang on. I lost Allie's camera. Okay, I can't find her, but I will. Do you guys see Allie? Is she still on? Okay. Or Allie Roberts, not Allie Buckner.
Yeah, she's still on. I can see her.
Okay, I'm sorry. I don't know why I lost her. Allie and Delaney, if you guys could please just kind of talk about how you feel like your education prepared you for the current jobs you're in. I think that would be kind of a good starting spot for these students to get a feel for how our Carroll education.
Hi, sorry, it keeps.
Oh, Allie, you just you muted yourself real quick. I don't know what you're. Okay,
I think she's having some connection issues.
Okay, aren't we all? Sorry, guys. This is just the Zoom world. Okay, well, Allie and Delaney, if Allie, if your connection isn't working, we can just hear from Delaney and you can hop back in whenever. But if you could just talk about that a little bit, and just so you guys know that are participating, you can put any questions in the chat and we'll make sure to get to it in the open Q&A in just a few minutes. So any questions you have for any of our speakers, you can start putting those in the chat. So Delaney and Allie, if you guys could talk about how your Carroll education prepared you for your current jobs, that would be awesome.
Where's Delaney at?
Hey.
You can go ahead and go first.
Okay. Well, like I said earlier, I honestly can say enough about our Carroll College education. I feel like exactly what Leah was saying, you get on the ground running pretty much immediately. Like right after you get into the nursing program, you're in clinicals, you're going and doing hands-on experience. I think by the end, Allie, you probably correct me if I'm wrong, but I think we ended up getting like 850 clinical hours or something like that.
It was like an insane amount.
Yeah, and I have, people I know and friends I know that have gone to other schools and different nursing programs, and we like knock everybody out of the park. We had so many clinical hours compared to so many people I've talked to, and every preceptor I had, I can't think of one bad experience. And I just going from college straight into the nursing world was definitely really scary, and it's a steep learning curve, but I felt so prepared, and I felt like everything important that you could need to know, I learned at Carroll College. And I find myself even still today, like 3 years in, going back and picking out experiences that we had at clinicals that I still look back upon and still feel like I gained a lot from. And so it's a lasting experience. And I think that it fully prepared me. I can't think of one thing that I would have wished we'd had that we didn't. Anything like that. I really can't say enough. So
Yeah. From my perspective, I think Leah kind of touched on it, is the clinical experience is something that really you can't compare to any other school, really. And the awesome part about our clinical experience is you're getting an opportunity to be in every single specialty. So you're doing a medical rotation, you're doing a surgical rotation, you're up on the OB floor, you're doing pediatrics. We also, I don't know if they still, correct me if I'm wrong, go out to the VA, which is its own kind of population in and of itself. And it was such a privilege to be able to get to experience all those different.
Allie, you're having a bit of lag. I'm sorry. I don't know.
And challenging, and it's nice to get. Did I cut out again?
It's okay. You're back now. You're back now, Allie. So I'm sorry. Some of it cut out, but we got some of it in there. Yes. Okay. I think we're still struggling. So I'm sorry, Allie, if that gets better, we can definitely finish that answer in a second. It looks like you're still frozen, but I'm going to move on to the current student remarks, and then we'll move into open Q&A. So Allie, if it does get better, oh, yes, but it looks like your video is still frozen. Yeah, so, okay, we're going to go to current student remarks, and then we'll see if we can finish Allie's answer in a bit. So for the current students, so for Lane and Allie, what is your guys' favorite part of the program? I know you mentioned some different things you're involved in, which is just really speaks volumes of like the type of students that are at Carroll, that nursing is time intensive enough and you still find time to get involved in all these different things. But what is your favorite part about Carroll College's nursing program? What do you think makes it really special?
Lane, I'll go first, I guess. Wow, that's a really good question, because it's hard to pinpoint one thing that I think I appreciate most. Whether it's like the classes or the faculty and staff involved, or back again to that clinical experience, I think one thing that I've enjoyed most is within classes and labs on campus, the relationship with the professors and the labs, like Leah and Abby and everyone's help. You can just tell that everyone is very intentional and very genuine, and the support that we have as students from those on campus and those on the clinical sites is just beyond what I had always expected. And it's just makes the world of a difference to not only have your professors or lab techs there to help you learn the material, but to support you emotionally and spiritually, and not only just help you thrive academically, but building kind of, helping pursue personal growth, because in that's going to help us become better nurses. And so whether it's in the coursework or just discussions inside and outside the classroom, I think that's one thing that I've really enjoyed is just that support and that push to get outside your comfort zone, but see things from kind of a bigger perspective, and not just caring for ourselves and for others on a physical basis, but really providing holistic care for ourselves and for our friends and for our patients. And and just kind of seeing life and like maybe problems and obstacles from all sorts of different perspectives, if that makes any sense. That's been my favorite.
Yeah, I mean, I would definitely agree with Allie, just with all the opportunities that we have to kind of work together as like a whole group. I think one of my biggest fears coming into nursing school would be like just that like it would be difficult to succeed. And I think that that's like a pretty typical fear just because nursing school can seem really difficult, but Carroll really sets you up for success. So yes, we're going to have the rigor that you should have at nursing school, and you're going to learn difficult stuff, but you're going to have a mentor that's there with you, and you can always ask questions. So like I've got a senior nursing student who I probably text weekly about different assignments or tests or lab things that are coming up or what to expect in this clinical or how to prepare for this thing. And she always sends me like a great response, and she's probably tired of me, but like she's just somebody who I can go to. Or like I have other friends in the nursing program, or I talked a little bit about the CCSNA or the Carroll College Student Nurses Association. And really that's just a chance for like a whole bunch of different people in the nursing program to come together, to get to know each other, to form friendships, and then to just use each other as a resource. Also, even with like our faculty, I was just talking earlier with some classmates, and we were talking about like who our advisors are. And I was like, yeah, I mean, I feel like I could go to anyone for advising if I needed to, but like this person is my advisor. Just because like the faculty, they'll email you about scholarships or job opportunities, or they'll email you about different, I don't know, like they'll write you a letter of recommendation for you. Like you can really go to anybody in the program, and you'll never feel alone here at Carroll. Just this like tight knit group that's like really able to work together and just kind of support each other along the way.
Thank you to all of you for answering those questions. That was really helpful. I see everyone's putting their questions in the chat. That is excellent. I think first, Leah, if you want to show us a little bit of that lab space, and then if you guys want to continue to put those questions in the chat, we'll go through those after Leah shows us a little bit of the space that she's in.
So I am currently, and I'll try not to make you motion sick, all right? I am currently in our sim lab, and I'm in kind of the mother baby area. And so we've got a toddler. Sorry, again, I'm going to try really hard not to make you motion sick. We've got a toddler here, chest rise, chest fall. We can, we've got wall mounted monitors, and all of those head walls with the suction regulators and the flow meters, those are all active. Okay, so like they actually work. We don't have concentrated oxygen, but we have compressors. So you get the hands-on tactile muscle memory of what you're going to be doing in the hospital setting here in a very safe environment. So this is our newborn infant in one of the warmers that actually, it does work. It is functional. And she is also high fidelity, chest rise, chest fall, and pulses. And again, we can put her up on that monitor, and we've got a little task trainer right next to her where we do injections and different skills. So again, I'm going to move again. So I'm going to try really hard not to make you motion sick. This is Lucy. We name all of our simulators because, and I'm sorry, students, I know you're so sick of me saying this, but we practice how we're going to perform. So if you've ever done a piano recital, if you've ever done any kind of sports, you practice how you're going to do it game time or recital time. That's the same how we do here in the labs. So we name them, we keep them covered and clean, and we use our body language just like we would with a patient, so that when you get into the real setting, you feel comfortable and confident in that. So this is Lucy. I can't get super close, but her eyes are little computer screens. I can make them jaundice or hemorrhaged or asymmetrical. She also can birth babies. She can, right now you can kind of hopefully maybe see her chest rising and falling to simulate breathing. She has heart sounds and lung sounds and bowel tones. We have IVs that we can run fluids through her. We use Alaris pumps because that's what the hospitals in our system use. And so we, run fluids. You've got all of that practice that you can do here in the labs before you go out into the clinical sites. There was a question as I move around. Sorry if I am making you dizzy. So there is, oh, I wanted to show you, see, that is a one-way mirror. We run the simulators, and so we are behind that. That's our observation area. Oh, and I've got even the computer I can show you that we, when we are back there, this is how we, there we go. This is how we work with the simulator. I can change the heart rate. I can change pretty much everything. We hire nurses into these roles, the lab facilitator roles. Like I said, my background, well, I didn't tell you, but my background is ICU nursing at Mayo Clinic. And then again, I'm a primary care nurse practitioner, specializing in gerontology and chronic illness. So we do real-time sims and I respond as the patient. So I always say it's kind of a choose your own adventure. If you give the wrong med, I'm going to adjust the vital signs and the patient response appropriately. If you give the right med, then you'll see an improvement, right? So it's a choose your own adventure. It's a lot of fun. This is one of our PD kids. We have a couple of them. And then we have some adults in the next section over. I'm going to just show you real quick. You can see that black camera over there. That thing hanging down is a microphone. And then there's another. So we have cameras at the head and the foot of the beds, so that when we're back there running the simulators, you can pull the curtain, you can feel like you are in the environment, as realistic as we can get it. And so we can just zoom around and we can record, and then we can debrief. It's really sunny. I wish I could show you the view. We are in a like all of our labs are west facing. So we look out at gorgeous Mount Helena. Sorry, I'm going to try really hard to stay out of the sun too much. Gorgeous Mount Helena, and we get to see the weather come in. It's a very relaxing, beautiful place to be. So this is another one of our simulators, an adult male. Yeah. And then we have a skills lab that's right next door. I don't want to take up too much time, but that's kind of a playground. This is set up more like inpatient hospital. The skills lab next door is, you come in, you learn how to do your IVs, your indwelling urinary catheters, all of those types of things. And then we have an assessment lab that is set up more like a doctor's office. You spend a ton of time in all of these spaces. One thing, and then I'll wrap it up, but one thing that also puts us apart is the caliber of students that we have. Again, I can't speak highly enough. We encourage our nursing students to come in and practice in the labs, whether we're here or not. Okay, so like I hire lab aides to come in and open the labs after hours, so from 6 to 9, Monday through Thursday, and 5 to 8 on Sundays. And I'm not here, but students are running it, and you can come in and practice. A lot of different places you have to reserve a week ahead of time, and faculty has to be present. But the caliber of students that we have and just the integrity, we have simulators. We have one simulator that's high fidelity, which means that chest rise, chest fall, all of those types of things, pupils that respond. He's 13 plus years old. We do CPR on him. We put him on a ventilator. We do all the things. And he's still in such good shape that we use him all the time. And our students come in and they learn by senior year. You're building simulations for your peers and you're running the simulators. And that's something that's really unique. Not every place does that. So yeah, hopefully that's helpful.
That's incredible. It's so cool to see it. I'm so glad you have the cart to move around and everything. So thank you, Leah, for that. So I'm going to go back to one of the questions we had. So we had a question about what specialties will our nursing clinicals be in. So I actually kind of want to direct this to Delaney and Allie, our alumni. What clinicals did you do that you can answer that with? And then what examples of other ones that you've experienced?
For me, I think clinicals wise, like clinicals that I did, and Allie could speak to this too. I know she mentioned this earlier. We really did kind of everything across the board. We did clinicals in pediatrics. We did clinicals in med surg, ICU, outpatient, VA, like she said, we saw all sorts of different patient populations. And for me, definitely, I think because nursing is so broad, you could graduate with a BSN and do like a whole myriad of different areas of nursing. I think one thing that was really cool is that we really did get to kind of dip our toe into pretty much everything I could think of nursing wise. And I think for me, you know, obviously I stuck inpatient and that's still where I am 3 years into it. But, you know, I've seen a bunch of different types of patients. And that was something that Carroll really, I think, set us up well for, because you never know what you're going to end up doing. And there's so many different people you could end up working with, and all types of nursing seem like they're, you know, very unique in their own way. And I think Carroll exposed us to all of that, which was really cool.
And then Delaney, while you're at it, the next one is for you. Was it hard doing cross country and nursing? Or I think it was track and field and nursing.
Yeah, it definitely was, but I will say, I think there was like 10 or 12 of us in my class that did sports. And for me, at least, I can speak to on the track and cross country team, the coaches are just amazing and they're so understanding. And I never felt like I was put in a situation where I was having to choose one or the other. Coaches were always willing to help accommodate, you know, clinicals, and especially my senior year with capstone, I actually ended up making the choice to leave the team at the end of my senior year, just because I wanted to, you know, my capstone ended up being on a lot of weekends. But I will say that was my choice. The coach even gave me the opportunity to help make that work. And I can speak to, I know people on other teams that played all throughout nursing school, and it definitely is hard. It takes a lot of, I think, a lot of patience and a lot of dedication, because you definitely do have to spread your time pretty thin, but the support is 100% there behind you. So definitely doable.
And I think that goes too for people who are finding themselves in the situation where you're going to have to work through college also. I was on the cheer team through Carroll, and I also had a job where I was working 12 to 20 hours a week. And same goes for that. It's very doable to have a job to help pay for your school if that's something that you have to do. It's just about learning how to time manage. And that is going to be one of the skills that Carroll prepares you for as well when you graduate.
Thank you guys. Real quick, there was a question, what is capstone? So can one of you kind of hop in and just explain what capstone is for those people who might not be familiar with that term?
Yeah, so capstone is like similar to people's like senior seminar. So it's kind of your final clinical rotation before you graduate. And your capstone is kind of your opportunity to dive first into a specialty that you're looking into. So you get to list out some choices, and then based on what's available in the state is where you'll get placed, and the professors are who place you in that location. So for me, I was interested in labor and delivery, NICU, and oncology, and I ended up getting placed in a NICU in Missoula. So I did travel to that NICU, and I ended up being on a night shift. So you get scheduled for shifts with a preceptor, so an employee of that hospital. So I would do a couple night shifts a week with my clinical preceptor in Missoula, so outside of Helena. And that experience is probably was my highlight of my career at Carroll. You are like a nurse at the bedside, and they throw you in there, and they're your patients, and your preceptor is kind of just like guiding you along. It's almost like nursing orientation when you start your first job is what your capstone feels very similar to. So you get to be completely hands-on, perform all the skills, do all the charting, everything. Yeah, so capstone is amazing and really something to look forward to.
Thank you, Allie. I appreciate that. One question, I think Leah or our current students could probably hop in on this one. Julian asked what type of preparation our students receive before they step foot in their clinicals. So whoever kind of wants to hop in there.
I'll start with that, and then I would love to hear from the current students. But yeah, we have, you are in lab, you are doing skills. We're checking you off as faculty. We're checking you off on the skills, saying, yep, you have met the minimum safety. You kind of know what you're doing. Go ahead, right? And you are never alone. There's always somebody with you. The expectations, the outcomes, the objectives are very, very clear. We hire nurses to be with you, and the ratio here is 1 to 4. So we cannot have more than 4 students with one, we call them CRRNs, and they are employed by us to be with the students when they're out in clinicals. You're never alone. But I would love to hear from Allie and Elaine how you guys feel that you're prepared to go out.
Yeah, I would agree a lot with Leah, what you had said as far as, you know, learning those kinesthetic skills and those hard skills. You'll have a lot of practice in the lab, as well as like relational skills. So it's nice to have exposure to that and practice it as much as you can to kind of build up that confidence, because definitely going into clinical can be intimidating for sure. So it's nice to have that background knowledge. And again, off of what Leah said, it's nice that you always have someone there with you. And so inevitably, there will be experiences or times in clinical where you come upon a situation that maybe you haven't learned about yet, or you don't feel prepared for. But it's great to have that opportunity, because then it gives you that chance to learn about it in the moment, but also have someone there to guide you and teach you. So it's not, you're not just getting thrown to the wolves. Like you have that basic knowledge that you need, but a lot of your learning, if not maybe most of your learning, is going to be in those capstone clinical experiences.
Yeah, I mean, I agree with Allie with what she said. I mean, when you start as like a sophomore and you're just starting to learn skills, a lot of what you will be doing is like the more of the basics, like using a gait belt and walking, like maybe some of you are CNAs, like a lot of those type skills. And then the more you learn, the more that you'll feel comfortable with, the more that you can kind of start to get into like more difficult skills, maybe starting a peripheral IV, or I don't know, inserting an indwelling catheter. But like, once again, there's always going to be that resource nurse there with you at the hospital, whose job it is to be by your side when you're doing something like that. So, I mean, you really can't make a big mistake. Like, they won't let you do that. So you don't really have to worry about that. They'll stop you before that happens.
Thank you guys so much for answering that. I really appreciate it. I think I lost Jamie. Jamie, if you're here, can you say something? Okay, I think his connection might have been bad too. So I'll just keep going with the questions until he pops back in. So I think Leah, if you could maybe talk about this, or I don't know if Delaney and Allie, if you guys thought about doing any education post your BS or after your BSN, but we had a question about how Carroll prepares students who want to pursue further education in nursing.
Sure, that's a great question. I will start just because I've, done that route. So again, I graduated a while ago, but I did an honors thesis, and my evidence-based practice course here at Carroll for undergrad was phenomenal. And I can speak to the current professor who's teaching that. And Elaine actually is in EBP right now. Allie finished it last year. It's very rigorous. So if you are looking to get an advanced degree, you're well prepared. So I will say that, and I went to a great university for my master's. My undergraduate honors thesis was actually more complicated and more work actually than it was to get my master's, just because of how rigorous Carroll prepared me. And I will say, like, I was really ready for graduate school. I didn't go into graduate school until, gosh, I'd been out for 3 or 4 years. And I was ready to rock and roll. And just in that same vein, I came from Carroll. So at that point, it was a 90-bed hospital in Helena, Montana, paper charting still, but I had gotten a job before I graduated my senior year at Mayo Clinic and in Rochester, Minnesota. And so that was a teaching hospital that was thousands of beds. That was quite the change. But we graduate, and we still do this to this day, nurse generalists, like we focus on your foundation so that you are ready to rock and roll. And I was able to, I mean, I felt like my foundation was so solid. I had the liberal arts background that you get from Carroll, right? That I was ready. I was ready. And so then, yeah, I'm sure that the other folks can speak to that too, but it's a very rigorous program. And yeah, I was ready to play with big dogs.
That's awesome, Leah. Thank you. Yeah. And if you guys have anything to jump in on, feel free, but I'll just keep going because it looks like we do have quite a bit of questions in the chat. So please keep sending those in. And just so you guys know, I should have said this at the beginning, we'll go until about 7:30 and then our speakers will stay on as long as they can. If you have to leave, that's totally fine. But if you guys have additional questions or are having good conversations, feel free to stay on. I'll definitely stay on for questions, but we'll finish up around 7:30 just so you guys are aware. Okay, so Kat has a really awesome question.
Hannah, I just have.
Oh, go, yes.
Oh, Hannah,
yeah.
sorry. I just have one thing to add really quickly. I'm not doing advanced practice right now. I'm not quite ready for that yet. I love the bedside, so I'm sticking there for a little bit. But my sister is a Carroll alumni, and she is doing her MP right now. And I think just to bring Carroll back full circle, offered to help my sister get her checkoffs on her skills, and of her physical. Alumni is always there for each other and kind of sticks with each other. And so that was really awesome to see that all of our alumni just kind of have each other's back when it comes to furthering our education and life outside of Carroll.
Thank you, Allie. That's a great addition. I appreciate that. So Kat's question, I think, is pretty interesting. And I think our alum would certainly be able to answer this. Maybe Allie, because you're a little further along. But Kat was wondering how did your favorite specialty kind of change? Like when you were going into college, did you have a favorite specialty? And then compared to after trying them out, did that change? Just kind of asking about what your favorite specialty was when you walked in versus after like trying those clinicals out.
I definitely think for me, I went into nursing school being like completely sure that I wanted to be in labor and delivery, and that's all I wanted to do. And the weirdest thing is you get exposed to so many, like I was saying earlier, you get exposed to so many different areas of nursing that it kind of just blew my mind. Like I had been completely wanting to do that and then ended up just like falling in love with cardiac, and I had no idea. And now today too, I've done, I started off doing telemetry, so I did about 2.5 years of cardiac nursing. And the cool thing about Carroll is I don't think I have a favorite at this point. And there's always more to learn. And as you start working, it just, like Allie was saying and Leah was saying earlier too, it comes back full circle to Carroll. And I find myself looking back and thinking back on all the clinicals we did and all the different experiences I had. And I think the cool thing is you really you don't have to stick to one thing, and you don't have to have a favorite even going into it. And even my capstone, my senior year capstone, at that point I wanted to do emergency nursing, and obviously I'm not doing emergency nursing now. I loved it, but there's so many different things to do. And so I think the cool thing is you never get locked into anything. You can constantly experience new things. You are free to move around once you get into the nursing world too. And so even if you do have something you're really wanting to do, it's not the end of the world if you don't end up there right away, because you can do a lot of different things with nursing.
My experience was the same also. I initially wanted to be an oncology nurse when I went into nursing school. And then during my OB rotation at Carroll, I was going through a really hard time, just personally in my personal life. And I was like at the end of my rope, wanted to quit nursing school. Like I was done. And I had a preceptor on the women and children's floor who was like, Allie, this is your calling. This is where you're going to end up. Like, you just wait, one day you're going to be a labor nurse. And I ended up back, and she's now my coworker. So it's like your perspective totally shifts and changes throughout your clinical experience. And then even when you get out into the nursing world, I did start out as an oncology nurse, and I did that for a year, and that job was amazing. Loved it, but I just wasn't passionate about it. And so now I'm in a field where I couldn't imagine doing anything different. So your career can ebb and flow and kind of grow with you as you go.
Thank you guys so much. Allie, do you want to add anything as like a senior student? I don't know, kind of, if you have anything. If you don't, that's totally fine.
Yeah, no, just very similar along the lines. I think as a student coming into nursing, you don't actually realize how many career paths there are within the nursing realm. I mean, it's easy to think of all of the different types of nursing within a hospital, but with public health or telemetry, I mean, there's just so many types of nursing that I didn't even realize existed. So that's one thing that's cool coming into Carroll and just your clinical experiences is you can easily come in, and one day, I've definitely had those days where one day I'm like, yes, I'm going to be an ER nurse. And then one day I'm like, oh, public health is actually so cool, or oh my goodness. So it always will change. At least I know for me, it will still continually change. So just touching on what Delaney and Allie had said, it ebbs and flows through your Carroll career, and I anticipate it's probably going to do the same afterwards. We'll find out.
Thank you, Allie. Leah, we've got two that I think you can probably do. We've got, what does diversity look like in Carroll's nursing program? And then can you talk about the hospitals and clinics around campus? So two for you.
Yeah, those are great questions. So we're in Montana, we're kind of central. And so we do have some limited opportunities for diversity. But if you kind of expand what that looks like, we are in, like I said, the Chaudere is a pediatric inpatient psychiatric hospital. We have the VA, which is for veterans, right? And so that's a government-run facility. And then we have this unique kind of, not a lot of them exist anymore. It's this independently owned hospital called St. Peter's that doesn't have a parent company like Providence or Kaiser or Sanford or Mayo or any of those. So it is really great that we get those opportunities. Those are the main ones. We also go into the Centers for Mental Health, which is adult psychiatric, and it's outpatient. It's a day program. We have diversity in as far as economics go. So you're going to see a wide range from folks, living well below the poverty level to the opposite end. We have several Native American reservations around as well. We have the Helena Indian Alliance Clinic that's like literally we can see it from our campus. And that is just absolutely wonderful. We have the Lewis and Clark Pub. We have a really great relationship with the Lewis and Clark Public Health Department. So we try to make sure that, like everybody's kind of said, that you're able to kind of dip your toe in to lots of different places. When you are in Capstone, that's where we do kind of send you out more across the state. We also, we have a lot of hospitals in Boise, actually, that heavily recruit Carroll nurses. And so we have started the last couple of years doing Capstone. If folks want to, they can go down to Boise or McCall area. And that's been really fun. We can send up to Browning, which again is in one of the reservations, in Browning, Montana. And so, yeah, that's kind of, again, economic diversity and a little bit of the other. And then again, we've got kind of this, I think it's 100 bed, maybe 105 bed hospital, St. Peter's, is independently owned. And then the VA, which in such a small town, it's really cool that you get to see both because they're completely different animals, right? One is a global system, and the other one is a local community hospital. So it's really cool. But then we also get to send out to the different clinics that are around here as well. I hope that answered the question.
Yeah, I hope so too. And if the question asker was specifically asking about kind of racial and ethnic diversity, we are in kind of a hard spot in Montana, but we are working on it as a campus. I know there's several initiatives year after year trying to increase our diversity and awareness of issues of, racial justice and things like that. So if you have more specific questions, we can definitely go into those as well. But I hope that answered that all right. I apologize about the noise. My cat is climbing a tree. So I'm sorry if you hear some funky noises. Okay, so let me get back to our questions. Okay, I think we kind of talked about in terms of enough time to have a job and also with clinicals and studies. I think a lot of these people were college athletes. A lot of them also, had different places of employment. Like Allie Buckner is working for our admission office. I think we covered that one, but we can definitely talk about it more later. There is a specific question for Allie Buckner, but I think our alum could probably hop on this too. So somebody was wondering, as a senior, how is the process going? How does it work kind of looking for jobs post-graduation?
Oh, that's a really good question. Because I remember that being a big stressor of mine, as far as there's just so much to think about. Your spring semester of your senior year, you are, well equipped. At least we're not even done with my senior year, but I feel like I'm already so prepared as far as the job search, because you take a specific course, leadership and management is the one, and you take intentional time in class to build your resume, write a cover letter, look at resources that are great resources that have job opportunities on them. We have discussed and done simulations for mock interviews. We've done just even looking at the differences of a profit or not-for-profit hospital, important cultural aspects of different employers. So all throughout your Carroll nursing career, you kind of touch about these things here and there, but definitely that last part of your senior year is nose to the grindstone as far as them giving you the resources and the support you need to be prepared and start applying and finding these job opportunities.
Thank you, Allie. And then if Delaney or Allie want to hop into, like, what was that like for you guys graduating and looking for jobs? If you have anything to add.
I think for me, and Leah, correct me if I'm wrong, I don't know if they still offer this, but we had our senior year, me and Allie had I can't even remember what it's called now, but it was a job search class, and there was people on campus that specifically would help you with not only your interview skills and preparation for an interview for a professional RN job, but there were also resources to help you even figure out how to put your resume together in a concise, good way where it's going to be presented well, and they would help you with all those little things that I think were, for me, the most nerve-wracking experience of trying to look for a job, because you're given all these things and all these skills and you have it all with you, but it was hard and scary to try to put that all together in a concise, way that you could present it to someone who you want to hire you. And I think for me, it was scarier than it was hard. I think Carroll really helped, and the nursing program and the professors and everyone really helped me to get my first job. And looking back now, I think I can't imagine how I could have had more support behind me, and it went really well. And I even getting this after I left my first job and I just got this new job here in Spokane, I even went back and looked at some of my old notes from my senior year on the interview skills and questions and things like that, and it helped me get my new job now. So I think it really sets you up well your senior year.
I also think Carroll has almost become, in a way, a brand name for nursing professionals. And while it seems like a very small school and we're in the tiny town of Helena, the weight of the name of I graduated from Carroll College really holds a lot of dollar value for a job. And it somehow, in some weird way, whether you're in Oregon or Florida, somebody knows somebody who is a Carroll grad, and that name in and of itself is like a gateway door that opens you up to so many opportunities. And it's like, you didn't even really have to do anything. It's like, for some reason, there's an unbeknownst amount of trust just because you went to Carroll. So that in and of itself was amazing, trying to go and find jobs.
Thank you all so much. I appreciate that. Okay, Leah, we've got some kind of logistical questions about some hopefully quicker ones because I think we're running a little low on time. But so some people are wondering about the nursing program and like number of students in the program, as well as the differences between pre-nursing, direct entry nursing, and kind of how difficult is it to get into direct entry or get into the nursing program if you are pre-nursing. So if you could discuss some of those kind of logistic details.
Yeah, that's a really good question. So we recently increased how many we take that sophomore year, right? So your second year to 48. We accept 4 transfer students, and then so there's 44 spots essentially for the direct and the pre-nursing. Most years we are able to get all of the pre-nursing in, okay? Most years. Every once in a while we get so many pre-nursing that we have to start going down a wait list. And some folks decide to stay, they minor in something, they you know, take more cores, they take more health sciences, and then they reapply that next year and they're able to get in with the next cohort. So direct nursing, and I don't have the rubric, but I think it's online, carroll.edu. So direct nursing, one, you have to apply, I believe, by November 1st, and you have to have certain grade point average and those types of things. It's a very specific rubric. And if you are accepted into that, then as long as you maintain a certain GPA and academic standing that freshman year, that first year with A&P and the biochem and psychology courses, you do not reapply. You're in, okay? You're in the sophomore year. You come see us, okay? If you don't make that, then you do not progress. You can apply and try and get that GPA or whatever may be happening. It's not like you're out of Carroll, but you don't get in that year. Pre-nursing, again, as long as you maintain academic standing, there's also a rubric for that. And then depending on the rubric, we actually don't, as nursing professors, we don't see it until it goes through admissions because it is a rubric. So, but yeah, most years we're able to get our pre-nursing students in.
Thank you. And then if you guys that ask questions about direct entry and pre-nursing, feel free to message me personally. I'll put my contact info in the chat too from the admission side of that house, and I can help with that. And then Leah, real quick, what stage of schooling do they work in the simulation labs?
Oh yeah, we get you in sophomore year.
Perfect. Thank you. Okay, so this is one where I think different people can hop in. I know some of you are in peer ministry, some of you were involved in campus ministry. We had a question about how Carroll integrates faith into the nursing program. And then I think there was one a bit later where somebody was asking how Carroll integrates faith into college life in general. So both kind of the nursing program and college in general. So if a couple of you want to hop on that, that'd be awesome. If any of you have to log out right at 7:30, that is totally okay. But we will get to all these questions quickly if all of the speakers are okay sticking around for a couple seconds after. So thank you. So we'll talk about kind of faith in nursing and faith at Carroll in general. Whoever wants to hop in. No. Okay, Lane, you got it?
Yeah, I could talk about it a little bit.
Thank you, Lane.
So, I mean, Carroll tries to integrate sort of all aspects of all things and sort of that whole holistic care that you're going to see out in your nursing practice, just because you're going to have to know a bunch of different faith backgrounds just for all people when you're caring for that. A lot of our nursing professors come from different backgrounds. I know like we have a couple who are Catholic. They'll like pray before class starts, or they'll like open with like a meditation or something like that. But a lot of it is just kind of incorporating all different aspects. I know like for like our child and like labor and delivery class, she teaches on like different types of like natural family planning and different things like that that kind of incorporate like that faith into Carroll's life. And then I guess for Carroll in general, the freshman and the sophomore floors at Carroll all have peer ministers on them. And what the peer ministers do is usually just kind of have like a floor activity like once a week. Carroll has like mass on campus every day. There's different outlets for people of different faith backgrounds on campus as well. And it really is kind of what you make it. You're kind of able to kind of explore that as much as you want. And you're definitely going to have the resources there if you want to. And if you don't want to, you're not going to be forced to go into that. Another thing with the faith in the nursing program, there's like a hand blessing ceremony that Carroll has, which is cool. It's like a white coat, like everyone kind of gets to wear their coats in the chapel, and just gets to be with all the other different classes and things like that. So yeah, there's like a couple different things that they have. A lot of what they teach is holistic care, and we get into some specifics and stuff like that. But yeah, the opportunities are there if you want it.
Thank you, Lane. I appreciate that. There was a question about Spanish. Did any of you minor in Spanish or take Spanish courses? I don't think so, but I do know it is, I don't know, Leah, do you have any insight on that if some of your students do choose to do that?
Yeah, some of them do. Yeah, absolutely. Some of them decide to minor in a foreign language. We have Spanish, we have French. Yeah, absolutely.
Yeah, and there was a question about kind of the ease of that, just getting a minor in general.
Getting a minor in general, I mean, it's challenging, right? Like nursing is very rigorous, but people make it work, right? So it's kind of like being the student athlete and working multiple jobs. So yeah, yes, there are I'm jumping ahead. There are study abroad opportunities available. Sorry, I just saw it pop up.
No,
there are study abroad opportunities available. In fact, I went to Swaziland, Africa, when I was a senior, and we worked with parish nurses with it in Swaziland, Africa. And yeah, so there's lots of different options.
Awesome. And then we're kind of just a couple more till the end. Somebody asked if clinicals are on all days and hours or just weekdays, and then how do students get to clinicals if they don't have a car? Yeah.
Right. So we have a few of those, right? I mean, we are a rural state, so having a vehicle is kind of helpful because, again, we are a rural state. But I mean, our students are really amazing, and they'll catch rides with each other, right? They'll borrow their friends' cars that aren't being used. So clinicals are primarily for our traditional program on Tuesdays and Thursdays. When you were in capstone, like the graduates have said, alumni have said, like that you're scheduled more with a nurse who's working shifts. So that could be night shifts, that could be weekends. But during the program, sophomore, junior, senior year, those are mostly Tuesdays and Thursdays.
Awesome. Okay. And so there was a question about transferring credits in. If the student that asked that could just email me directly, just because it really depends on the class, on the level, kind of things like that, that would be helpful. And just to kind of close us out, somebody did ask kind of what advice do you have for a student hopping in on the nursing program? So I think everyone could answer this question, and that could kind of be our closing question. Thank you guys so much for sticking around a little past 7:30. I really appreciate all the great questions you put in. Please email me if you have any questions. If you have more specific questions for our speakers, I can definitely, ask for their contact info if they're comfortable sharing it, but just email me if you guys need anything. And again, thank you so much for joining us. This was really awesome. So kind of to finish us out, if everyone could kind of give a word of advice or what they wish they knew, just kind of talk to our students who might be starting their program this fall. And we can start with anyone. It looks like, okay, Allie, you're good to go.
I'll go, just because this is one that I think is super important, is whether you're nursing or whatever you decide to study, finding activities outside of school that you're really passionate about and finding that outlet, because school and college, it's rigorous and it's time consuming, but making sure that you're still getting that passion filled and filling up your cup with things you love so you can just be re-energized and kind of just be full of life when things get stressful. That's definitely one thing. For me, it was just getting outdoors and moving. For some people, it's reading, music, whatever it is, find your thing and latch onto that, because that's going to get you through some tough times.
Allie, that's exactly what I was going to say, actually. I think I completely agree with that point. At my time in Carroll, looking back now, what I remember most are the people I met and the experiences I had there. And it still rings true in my career now, 3 years in. I think that if you can't leave work at the end of the day and feel fulfilled in yourself, you're not going to take very good care of your patients. So I think the number one thing is making sure that, like Allie said, you fill your cup at the end of each day and you make sure that you're getting what you need and you have a balanced and whole life. And I think Carroll completely sets you up to do that as well. I never, looking back on my experience there, some of the people in the nursing program are still some of my best friends today. And you'll really feel at home as long as you open yourself up to that at Carroll.
I was gonna also say that. But yeah, just getting involved in Carroll outside of the nursing program and inside of the nursing program. I know Elaine had mentioned he was a part of the Student Nurses Association. I did that as well when I was at Carroll, and that's an amazing program to be a part of, just an extra layer of support. But aside from those things, I think would also be like finding your tribe, like your group of people, which is very easy to do. It's not scary if you're going to Carroll alone and you don't need anyone. Everyone is, or have anyone going with you. Everyone is like right at your fingertips. So those extra things that you get involved in is a great opportunity to meet friends outside of the nursing program, but also finding people within the nursing program that kind of become your buddies and your study buddies, and finding people to get through it with would be my piece of advice.
All right. Yeah, Lane, you go. You
All
go.
right. I'm not sure necessarily what my piece of advice would be, but honestly, I think it just comes down to like, you can do it. Like for me, it seemed really scary as a senior in high school to think of like nursing school kind of, I think, has this like stigma around it that it's super difficult and super hard. But honestly, you can do it. And like here at Carroll, we're going to give you all the resources that you need. So as long as you're like working hard, your professors are going to work with you. They're not just going to let you flunk or anything like that. Like honestly, like it's just super comforting to know that you can do it. And I promise you'll be okay.
All of this like warms my heart so much. Just hearing it again from the alumni perspective and now being faculty, it's yes to everything that these amazing people have just said. Help keep things in perspective, right? Like you find things that fill your cup. Self-care is massive, and we need to be able to be okay with ourselves before we give of ourselves, right? And you can do it. If you have not come here, if you have not visited here, please come see us. I think you'll feel the difference, right? You will feel it. It's a pretty special place. I was not going to come here. It was the last college that I went to because my mom made me back in 2000. And I ended up not even applying to anywhere else because I was like, this is where I'm supposed to be. This is amazing. So if you haven't been here, please come see us and contact us anytime. Thank you so much for such a great evening.
Thank you guys so much. If the speakers could hang on for a sec so I can say thank you. Just as Leah said, if you guys have not visited campus, please do so. For me, I'm from Spokane. I applied to 10 colleges. It was very overwhelming. And the thing that helped me was getting on campus and taking some time and trying to picture yourself in that environment. Can you see yourself kind of going to school there? And for me, it was a yes. And I think for you guys too, going and seeing the nursing floor in person, it's really special. So I put the link in the chat to sign up for a visit. But I just want to say thank you so much for all the great questions. And I really appreciate this. Sometimes, you never know if people are going to ask questions, but you guys did a great job. So we really appreciate that. Thank you so much and have a great night. And let us know if you have any questions too. Thank you. Thanks, guys. We need like some goodbye elevator music or something.
Hi, I had another
hi, Lily.
question. Hi, I had another question about the Spanish program.
Oh yeah, totally.
So I've been planning for a long time to double major or minor in Spanish, and I was wondering if there was like a special program to do that with nursing, or if it's just a regular minor in Spanish aside from nursing.
Yeah, Leah, I don't know if you want to hop in on that or I can talk about it. Okay, that's totally fine. There aren't really any like special programs. I think, Lily, I'm trying to remember, do you have any like credits you're bringing in, like any dual enrollment or AP credits or anything?
I think I have some 3s and 4s, but I haven't looked
Okay.
specifically at what Carroll takes yet.
Okay, that's okay. Yeah, we can talk about that personally. But if you're bringing in credits, that makes it a little easier to like get a double minor or a minor or a double major. If you were to try to do something like a double major, you might be looking at like taking some summer classes here and there just to make sure that you're not overloading your semesters. And especially with clinicals, you know, that's going to be really demanding. So we can talk about that. You and I can do a meeting or something about that too. But I was able to do like 2 majors and 2 minors, and I didn't bring in a ton of credits, but I did like some summer classes here and there, and that helps too if you are looking at wanting to do some sort of double major. But any 4s or 5s that you have on APs, those will come in for credit. So we can look at your specific case, but it would just be an individual like Spanish minor if you wanted to do that. So hope that answered it.
Okay, awesome. Thank you. So
Okay.
should I just email you to
Yeah.
meet sometime?
Yep, we can totally do that. I have like set office hours where you can sign up for a virtual meeting, but we can also do a longer one, or if you just want to email me too. So yeah.
Okay, awesome. Thank
Okay.
you so much. And thank you guys too.
Thanks, Lily. Have a good night.
You too. Bye.
Bye. Okay, the rest of you that are on, do you guys have questions? And if you guys have to go, sorry to keep you later. I was just wanting to say thank you, but it looks like we might have some people still on. Oh, no, everyone's leaving now. Bye, thank you. Oh, okay. Well, thank you guys so much for joining and for your time and everything. That was really awesome. Not all of the virtual events are like that all the time. Not all students are like willing to ask questions. So that was really awesome. And I appreciate your time, especially Allie and Delaney. I know you guys were asked this kind of late, so thank you for coming in so clutch. That was very awesome.
Always happy to do it.
Thank you. Yeah, we really appreciate it. And especially like, you know, we hopefully moving past COVID, we'll have more like opportunities for alumni engagement, like not virtually all the time. So yeah, it's good to know that, you know, you're willing to like help us out sometimes. So thank you so much. But yeah, I'll let you guys go, but I really appreciate it. We did record this. And so like if anyone asks for it, I'll send it out. But if you guys, you know, have any questions for me, you can always reach out too. But thank you so much. I really appreciate it.
Thank you, Hannah,
Thank
too.
you.
And thank you, ladies.
Yeah.
Thank you guys. Like, this was so, like, just filled my
special.
heart. Oh, and just big hug.
I can't do it. Yeah, thank you guys so much. I really appreciate it. Have a good night. And yeah, you're the bomb. Thank you.
Bye, guys.
Bye.
Bye-bye.